Some folks are labeled with conditions that is not their fault, and they just need support and some intervention that will bring out, a better outcome. And that is why we're having this educational video today. Thank you for tuning into my channel, and I appreciate coming every time. My name is Dr. Debbie. I'm a mental health clinician, doctoral prepared mental health nurse practitioner, and I practice and see patients in the state of New York and Maryland, the United States. And you can check, my bio, to book discussions on mental health, and then to get to my practice, for treatments if you live in the state of New York and Maryland. So today we are going to talk about autism spectrum. And autism is a childhood developmental disorder that is characterized by a range of impairments in three domains of social communication, that is restricted or repetitive behavior and language development and usage. There's a milder form of autism, which is the Asperger's disorder. It's a less extensive form of autism, and that do not include language impairment. Autism spectrum is typically evident, by the second year of life of, it's a childhood developmental disorder, as we've said, and it's noticeable within by the second year of life. And impairment in social interaction even may not be noticeable even in the first year of life in some category of young children, but in some category even within the first year of life, the symptoms and they are well noticeable. People can observe that something is not going on smoothly, and in milder cases, as I've said, cause symptoms may not even be noticeable for some years. Because it's a spectrum, it's just like something that is in a straight line. We have the mild, we have the moderate, and we have the severe. So like the mild aspects, as they grow up with support, with treatment, with resources, there's better outcome, and they are able to catch up with their peers. But in the moderates, they need more support, which we are going to talk along the line as we discuss. And in the severe aspects, may have more obvious symptoms, exaggerated symptoms, that they will need a lot of resource. They will need maybe like a special education and all that. So like we want to see, the symptoms of autism. Most of the time, like I said, it's noticeable within the first year of life. Like we're expecting social interaction, eye contact, social responses, engagement, like smiling to a little baby. I do that a lot, maybe like in the store, and then the baby, the mom is or the dad or the parent, they are busy, looking at something, and you see the child, responding, giving you beautiful smile. Or maybe you are the one that just, maybe make some wave, such kids, expectedly supposed to respond back. But like in autism, they do not show any interaction or engagement. They are always very blunt. They like to be isolated. So they like, repetitive behavior, like hand flipping, like walking on their toes. Odd play, they are very rigid, repetitive, monotonous play. They lack social skills, as I've explained, and your spontaneous non-verbal social interactions, like, smiling back, even to little baby that, they are not yet babbling and all that. But those are the first symptoms, or those are the first interactions you see with little babies, giving back smiles, when they have eye contact with people or any human that is around them. So like this category of kids, with autism, they lack social interaction, engagement. There's no social smile, as I've already mentioned. They may not even acknowledge or differentiate important persons in their life, like their parents, their siblings, their teachers. They don't even care if you leave them, with strangers, because they find it difficult even to be able to differentiate between people that are important in their life. So they are not scared or afraid of strangers, like usually you see kids in the presence of stranger, they are afraid, they have anxiety, they may be crying, they are not showing willingness, to be carried or picked up or any interaction with stranger. But with this, they don't react. They may not react strongly, to being left with strangers. And also, they have decrease in language or no language use, and also there's delay in language development, repeating words of others. Instead of, like, some of them have explained that we have the mild, we have the moderate, and the severe. Like the moderate, uh, or the mild may not be noticeable, maybe, with support, some symptoms. But the moderate, that they have delay in language development. By the time they are picking up with the language development, they are repeating the word of other people. Like if you said, oh, you're Teddy, then day to day will say Teddy. If it said, okay, like your phone, day to day, they just repeat the words of other people. They are not willing to bring up their own word, because there's a kind of delay in their language development, for them to have their own vocabulary. And they are always very obsessive, desire to maintain the same thing. They are afraid of change. They just like routine. Yeah, and it's upset them a lot. Like, okay, traveling, or even changing rooms, or changing anything like that. They are always intolerable to change. They like routine, everything, again and again. And change of any form can really frustrate them. Also, they display extreme anxiety, when their usual routine, as I've explained, is disrupted. They have a low frustration tolerance. Like if maybe they are playing with their toys, and then, maybe they are building something, or like joining some things together, and there should be one of them that goes off. It's really it can get them, like into outbursts, into tantrums, into aggression, meltdown, and then they may start to roll, shout, yell, lash out, and scream, because they have low frustration tolerance, and they like repetition of everything, as I've explained, and poor eye contact. Like they don't respond to social interaction and engagement. They prefer pictures, or inanimate objects. And then, yeah, and that's why even they like also, to be watching maybe movies or something like that, that they are comfortable with. They enjoy spinning. They can be spinning and then banging. A lot of them, when they are having tantrums and meltdown, you can see head banging is part of the characteristics, of autism. And then they enjoy it, like I said, monotonous activities or actions, like watching water flowing or lining up objects. They have fixated interest, and then strong attachment with unusual objects. If they are attached to this toy, even if it is not their own, you see some of them, maybe toy of another kid, and then they love that kid to really be. It will take time, because it's going to disrupt them when you get that toy from them to give it to the owner. So talking about the predisposing factors, prenatal and perinatal complications, anything around the childbirth, maybe during the pregnancy or during the childbirth, if there are any complications, or like advanced maternal and parental age at birth, maternal gestational bleeding, like I've said before, like complications around childbirth, firstborn, uh, you know generally the cause, the causes, the actual cause of autism may not be unknown. But as I've said, these are predisposing factors that, science, from research, I've seen that people with autism have this type of predisposing factor. And it's really, interesting, to know that firstborn, the baby being firstborn, is even a predisposing factor. And I've seen that a lot, in many populations, race and all that, that the child just being firstborn and happen to be autistic. Umbilical cord complications, birth trauma, fetal distress, small for date or low birth weight, and APGAR score at 5 minutes. When the baby is born at 1 minute, in the labor and delivery room, the midwife, they want to check, the response of the baby to the first cry, and that, within 1 minute, and at times, maybe due to distress or one thing or the other, 1 minute, but it is important 5 minutes. If the ABGAS score is low, most of the time the score is always over 10. That's how quick the baby is able to respond to cry, to move, and the heart rate, and the breathing and all that, and the skin color. So they check all that. So if the score is low, maybe scoring below 10, 9, below 9, below 7, low, maybe some babies, because of distress, birth complications, they can be scoring as low as 3, as 4 at 5 minutes, because at 5 minutes, resuscitation in the labor room, giving them oxygen, and all that should have helped them, that by 5 minutes should have been able to adapt, to the life outside the womb. But if it is still low, that child could end up, with autism. And congenital malformation, blood group incompatibility, probably ABO or resource factor, and then bilirubin, staining the brain due to breaking down of red blood cell, probably in newborn due to uh, blood group incompatibility. So all these are very essential and important, especially because we said most of the factors, predisposing factor, is around complications during pregnancy and before birth, or around the child birth, around the birth of the baby. So it is essential that people get, adequate care, during pregnancy, during the prenatal, during the perinatal, to make sure that you attend, all your appointments, all your visits, any complaint, anything, and make sure you check, all your routine screening, and get adequate care, because of the baby, all those that that are because of work, I will go, don't delay, because the life of that developing baby, may encounter things, and the outcome may not really be pleasant. And then because of delay in the baby catching oxygen, like I said, I poked low oxygen to the brain. If the baby, the ABGAS score at 5 minutes, or maybe at birth, the baby is not able to initiate, their own breathing immediately, it's because it's kind of insult, to the brain. And all this is around the central nervous system. The incidence, that is the occurrence of this autism in the population generally, is about 1 to 4, male to female. So the incidence is higher, in male children, and is lower, among the female. But the females who do have it, and the Asperger's that I said is the milder one, is more common, or the other classes too, among the female kids. So what are the treatments? Social skill training, and behavioral therapy and psychotherapy, educational services and accommodation, depending on the level. If it is moderate, even if it is mild, because it's a lot of concern for the family, like delay in language development, and at times if they don't develop their language on time, it could even affect their learning and development in other area, their executive functions. So it is important that once we just notice it, and it's good to take babies for their child welfare clinics, so that it can be picked up. As I've said earlier, there are some of them that are being able, observable within the first year of life, when the baby is not showing, interactions, engagement, social smiles. They like to be withdrawn, isolative, temper tantrum, and then they even babbling, like kids from around 3-4 months, they are babbling, they're just saying, trying to form their words and all that. So when all those are delay, is good, to check in with their pediatrician, and as the baby grows, they can refer them to appropriate scholar. They get the help they need, they get the support they need, and most of the time it has good outcome. There are some that they miss the diagnosis, or maybe because people do not seek treatment on time, and then from mild can become moderate, and then become severe. And one of the reasons, why these kids at times, even as they grow up, and they have a tendency, for aggression, for temper tantrum, is because of the frustration that they are not able to express themselves because of that delay in the language development and usage. So it is very important. That's the essence of this video, for educational purpose, for awareness that the support is necessary, intervention, help is available. Make sure that you seek help on time. And there are a lot of people that, it can even be later in year that, it's very mild because they get the help, and then when they don't get it, life become very complex, for them. Things that will have been reduced, or prevented, it's becomes a problem. So, and in school as well, like for the moderate and severe, the educational services and accommodation, like in the United States, most almost yes, the states, they have 504 planning, that and accommodation or special education. Maybe the child will need one-on-one support, we need language training, we need the occupational services, like coordination and every form of services and resources, to help that child to be able to catch up with their peers. And it can be very yeah, an unpleasant situation for the entire family. So the family needs, counseling, and of course for the individual too, we use in combination with psychotherapy. Even for the child, we use medications as well, in some instances. And I hope we learned something. So this is educational video, so please share these videos that other people can get, the awareness that uh, the earlier, the help is sorted, or the intervention is received, the better the outcome, and this should not limit anyone. So my name is Dr. Debbie, your mental health clinician. I practice in New York and in Maryland, so you can reach out and check my bio. And I do consult for every form of mental health discussions. If you want to ask questions, if you have any clarification, anything, help is available. And as they say, prevention is better than cure. So we should not limit, the life, or the life of these young folks, because we deny them, the support, the resources, the help they need. And that's why this educational video is coming your way. Thank you so much. Like, share, and comment. Until my next video, have a positive mental health. Bye.